Mobilizing, all right? It is not the most comfortable thing, particularly if it's restricted, okay? You want your patient resting comfortably. You want their legs supported, okay? And you usually want their legs up on something because that'll obviously help you kind of slacken the abdominals a little bit and slacken the hip flexors. So it could be a stool like this, could be a chair, could be even a couple pillows, but you want them up a little bit, okay? Now, you want to imagine an imaginary line. You want to imagine an imaginary line between their belly button and their ASIS. So kind of on that diagonal, and you're going to take the midpoint of that imaginary line, okay? You're going to sort of approach in with your fingers like this on the diagonal. Okay, and this is a little bit of an uncomfortable area, and we're getting down to psoas, which remember from anatomy is way down, deep in there. So I got to get through abdominal contents and let things move out of the way and all that kind of stuff first. So we're going to slowly and gradually advance our way down until I basically feel essentially psoas and that posterior abdominal wall. And yes, you can work your way through that as long as you're sort of advancing in slowly. So find umbilicus, find ASIS, midpoint, kind of come down an angle, sort of a medially directed angle, and just slowly work your way down and through there. All right? And you know, you kind of distract your patient. You talk about what they're going to do this weekend, or just don't let them laugh because then it doesn't hurt and they just push your hands out. Alright, relax. Okay, if there was, like if you were a carnivore and you wanted to eat part of the human body, you would eat the psoas muscle because it's kind of like the tenderloin. So it's going to feel... You remember from anatomy what it looks like. It's this tenderloin looking muscle, right? Okay. So I'm working my way down in there until I kind of feel where I am. And then if I think I'm there, I'm going to have you ever so slightly, very, very slightly, think and slightly flex your hips. Just kind of slide that heel back towards me just a little bit. Just relax, relax. Just your right. Perfect. Okay. And I should feel that psoas muscle pop right underneath my fingers. So that's where I know, that's how I know I'm there. So now that I'm there, I can kind of do more of a parallel type of mobilization. You're a little restricted right there. You don't like that too much, do you? Okay? So I can do like a parallel mobilization, or I can do a perpendicular mobilization. Which do you think is going to be more aggressive? Perpendicular. Okay. So I get down in there, and I'm just kind of working sort of a parallel mobilization, trying to loosen that up. And you will pretty easily kind of feel some restrictions and some tender points down in there. Could you tell when I shifted down? Yeah. Okay. The other thing that you can do in that position, the other muscle that sometimes, particularly with back pain, becomes an issue is iliacus. So with iliacus, I come down more towards the ASIS, get down in there, and then, ouch, and then use my fingers, and I have to get into that fossa of the ilium, right? That's kind of where iliacus is. So I dig in there, and I'm going to kind of work my hands. I picked a good patient. Relax. And kind of work my hands out, you know, kind of in that pelvic rim, essentially. Okay, don't worry too much about iliacus, that's kind of an aside. But I definitely want you to work on psoas. Compare right to left. Okay, is there a difference in right versus left? And for a lot of you, there probably will.